I'm Dr. Leslie Appiah. I am a board certified obstetrician gynecologist, and I am fellowship trained in pediatric and adolescent gynecology. I serve as the medical director of the Fertility Preservation and Reproductive Late Effects program here at the University of Colorado and Children's Hospital, Colorado. And I joined the institution fall of 2019, immediately prior to the pandemic. I serve as division chief of academic specialists in OBGYN, in addition to my role as medical director of the program. So I wanted to become a doctor at age 9. And at that time, my goal was to help pregnant women bring healthy children into the world. So I wanted to partner with them, help provide their health care so that their pregnancies could be healthy and that their children would be born healthy. And that journey started with a family friend who was pregnant when I was that age, and I was able to go through the process with her, observing her belly go from being flat to being round and rotund with a baby inside. And I was just fascinated by the idea that something could grow inside of another human being, and just began learning that normal growth is dependent on many factors and wanting to play a role in that. As I entered medical school and residency, I became more interested in reproductive biology and reproductive endocrinology, and really understanding the hormonal mechanisms that help women to have healthy lives. And I think what has guided me is really wanting women not to be hindered by their reproductive health, right? We're amazing creatures. We have great things that we want to accomplish in life. We want to serve our community, take care of our families. And we can't do that when we're not feeling well and when we have a lot of gynecologic concerns, fibroids, endometriosis, hormonal challenges. And I want women to be able to live their best full lives and take the reproductive health concerns out of it. So that was my transition from obstetrics to gynecology. So I don't see any pregnant patients unless I'm trying to help them conceive. And then once they conceive, I transition them to my other partners. I approach patient care from the standpoint that the woman knows her body the best, right? She lives with herself every day. She knows when things felt right and when things began to feel wrong. And so I believe it's our responsibility to partner with the patient on her journey. So first, to listen extremely well to what she's saying and what she's not saying, and ask those probing questions to get to really the heart of the visit and what's really bothering her. And then partnering with her in developing a plan, right? We know what the treatment plan should be based on our textbooks and what we know from the literature, but every patient is different. And there are often many choices that a patient can choose from. And so I believe that my responsibility is to provide those options to the patient and then help her identify a path forward that is comfortable to her, that fits with her lifestyle, that fits with her family beliefs and structure, and then follow her through that. In a nutshell, partnering with the patient on her journey so that she has the best outcome. I feel very privileged to be able to share what I consider to be the most intimate space with another person, another woman. And women share their stories with me, and I take that very seriously, right? Typically, my patients are sharing things with me that they have not shared with their partner. They have not shared with their friends. Sometimes they're not sharing it with themselves, right? Because they're not really delving into their concerns. And so I just really enjoy that one-on-one relationship, learning their story. I often share some of my story with them. So it's usually a bi-directional exchange of information. And that's what I enjoy the most about the interaction, getting to learn more about them, hearing things that they really are struggling with but haven't shared with others, and then helping them develop a plan to address those concerns, and then having them feel better on the other side of it. And I think that's special. I mean, I get to have that experience with thousands of women,